Okay, welcome back. We're into session 2. This one is called Tech Solutions for a Regional Travel Bubble, sort of following on what the preceding session was on digital nomads. Our speakers are Mr. Donovan Smith, ICT consultant, CARICOM IMPACS. Mr. Smith is a dedicated telecommunications professional with extensive experience in engineering, administration, and support of telecommunications networks. His experience also includes the design and integration of viable technical solutions. We also have Dr. Lisa Indar, who tells us she's in St. Lucia, Director of Surveillance, Disease Prevention and Control Division at CARPHA, which has been playing such a pivotal role in the COVID-19 pandemic. She's a public health scientist specializing in infectious diseases, food safety, and tourism and health. We have Mr. Frank O'Carroll, Chief of Staff at Digicel Group. He has many years of experience in business development and expansion and has worked in a variety of roles since the inception of Digicel, including business development, government relations, and business solutions across the Caribbean, Central America, Asia, Pacific regions. We have Mr. Filipe, I'm hoping it's Filipe and not Philip, Filipe Reis, the Regional Director for Airports, Passenger Cargo and Security of IATA. Mr. Reis has more than 25 years experience in the civil aviation sector and coordinates IATA initiatives on improving security and facilitation. And this session is going to be moderated by a fantastic woman out of Barbados, Dr. Annalee Babb, who gave a great presentation yesterday. So Annalee, it's all yours.
Thank you so much, Josanne, and your good friend from Barbados, Annalee Babb. Good to see you again. Welcome to all the panelists, ministers, excellencies, Mr. Secretary General Rodney Taylor, all of our invited guests and viewing audience, welcome to this session on tech solutions for regional travel bubble. My assumption is that I was asked to moderate this session because of some work that I did in Barbados when I was the special envoy of the Prime Minister and special advisor to the Minister of Innovation, Science and Smart Tech. We created the BIM Safe solution and the SHAPE application to help manage and monitor travelers coming into Barbados and so on, keep them in quarantine, etc. We had maybe about 2 to 3 months to build that solution. So I'm excited to open this conversation to a wider audience. And this morning we have individuals who represent health, telecoms and ICT, civil aviation and security. And I'd like to throw the ball directly to Dr. Indar, and I'm hoping that we can all agree to use first names today and be on an informal basis. So Lisa, if you would, I'd like to throw the ball to you and have you share a little bit with us about from a health perspective. Each of you will share from the perspective of your own expertise and sector. But when we talk about a travel bubble, what do we mean? What does it mean in the context of each of our sectors? What is required to move people throughout the Caribbean in a safe, secure, and simple way? And when we had initial conversations as a panel about this, everybody had a different definition of safe, simple, and secure. So this should be a pretty interesting conversation. Lisa, over to you, please.
Yes, good morning, everyone. It's a pleasure to be here. And thank you, Dr. Bob, for giving me the privilege to start this batting, I have a short presentation that I'm going to talk about, our regional travel bubble, and hope that helps to define how CARPHA sees the travel bubble from a health perspective. Permit me to share my screen. Yes. Can you confirm that you're seeing it?
We are.
Right. So just to give a little bit of a background for CARPHA, because, this is being live streamed, CARPHA has this pivotal role when it comes to surveillance of illness. And this then pertains to creation or the different factors for arriving at a traveler's health bubble. And whatever we do from a surveillance or monitoring of illness, we really do it from a regional health security. When it comes to COVID, we have been leading this response from a regional health security. So, and what do we mean by that? It's really ensuring the health and the safety of persons from the health standpoint, meaning that they are not infected with COVID, that we put measures to ensure that that they can prevent the introduction and the spread of COVID. So we look at it from the health point, and we leave the security from, in terms of crimes and other issues, to our other partners. So we have taken this multifaceted approach where we look for, at the highest level, we help developing all these different documents, and we are meeting with our heads of government and so on. And incidentally, last year, we actually developed the regional travelers health bubble, which I would go through in a minute. But laboratory support, we work very closely with our tourism industry because we're the most tourism dependent. So the health and safety of our visitors, travelers, we know that the first case of COVID would have come in through a traveler, but what do we need to protect our borders? What do we need to do? What are the requirements for that safety? We promote vaccination. We provide a lot of different surveillance information. We have situation reports that come out that provide information, and we give you guidelines, and we have a stamp, a healthier, safer tourism stamp, which really is part of enabling that bubble. Because if you're doing certain things like going through a COVID-19 training and reporting illness, you are ensuring you're implementing preventative measures, which then allows you to have those safety measures that requires in a travel bubble. So the question that was asked, what is required for people to move around in safe and secure environment? As part of the requirement for moving in the travel bubble, or to have that safety from a health point, CARPHA would have had certain recommendations that we would have put out when COVID started, and this has not changed. We still require, for all travel, whether you're traveling by air or by sea, that proof of that negative COVID-19 test. And we preferred the PCR because it's 99.9% sure. And then there are other measures, during travel, such as temperature checks and so on. And then those proactive health measures that allows you, like using, going through a training and so on. However, we promote, when you are in the country, we promote the measures of physical distancing and mask and hand hygiene, stay at home if you're ill. If persons are not vaccinated, now a lot of countries have reduced their quarantine, some still quarantine, but especially if someone is not vaccinated, the quarantine measures are more strict. And finally, and even, our newest measure since vaccines have now become available as of last year is to ensure vaccination. These measures are all important and are prerequisites to ensure that you can have safe travel within that bubble, and safe and secure tourism and safe and secure health within that bubble. The other thing to note too about these measures is that, even though you're vaccinated, you still need to do the public health measures because, we have not reached that herd immunity as yet. So the travel bubble for our purpose and for the purpose of the CARICOM bubble, we would have defined it from a health safety point as this partnerships between countries, more our CARICOM countries that have shown, that allows for travel, safe and healthy travel between a set of countries that are carrying out certain measures, and based on their COVID rates and the measures that they are carrying out, that they can have safe and secure travel. So it allowed for countries to open their borders for within the countries, for instance, like Barbados and St. Lucia and so on, while our international borders were closed. And our requirements were pretty stringent. You know, it was based on rates of infection, and it would have, at that time, you know, you had to have less than 20 cases per 100,000, and the travelers would have had to have that negative PCR test. And now we are asking that, you know, we are also recommending vaccination, and the bubble will allow for all citizens, you know, to forego the quarantine requirements if they would have gone through, if they're coming from a place of that low infection rate and they presented a PCR and they were vaccinated. So at that time, when the bubble was recommended, we had different levels. If you, of course, if you are very or zero risk, if you were coming from a country that had no cases, or low risk, medium, high, and very high. Of course, the countries that were in the low risk was allowed to be in the bubble. And we went on, and I wouldn't go through all these different requirements. We can share the presentation, but for the bubble to operate, it meant that information had to share in a real-time manner. So to support that, we created a database, a COVID-19 platform that was that is accessible for all our chief medical officers. So they are able to see at any time, in real time, what's the rates of infection, because you needed to see that to know, you know, how the travel bubble operated, if it could operate, if someone had to move out because their rates of infections were so high, if there were clusters and so on. And of course, we wanted them to have proper reporting requirements, sharing of data, the centralized posting of the communications, notice if there were any changes, the PCR in testing information to be available to all, any updated or change in the travel protocols we would have want them to share, and of course the line listing. So for the bubble to work, the communication or the digitalization of that was important, so that information on testing and rates of infections, change in protocol, change in border requirements would have been shared almost instantly. And we went on, it's a very detailed document, pre-travel, en route, you know, what you do after leaving the airport and so on. And of course, the most important requirement is to have that accurate and timely reporting to being shared and be available through the digitalized platform. I have I have a couple more minutes. It will be really remiss of me if I don't talk about our Regional Travelers Health Program, because this is one of the programs, another program at CARPHA that was really set up to encourage health and safety among our travelers, and to create that, to promote initiatives like the travel bubble, to promote healthier, safer travel, to promote safety and security from a health standpoint. So it's a multifaceted program which has systems of reporting for air travel, that's a tourism and health information system, and from the cruise ships, which is the CBSS system. And it is supported by guidelines for response, by policy, by lots of training, by standards, by partnerships, international and regional partnerships, you know, with not just health, but tourism aspects. So the World Tourism Organization and the Center for Disease Control, where we share information. And to add the incentive for the tourism or the private sector, we launched a Caribbean Travelers Health Assurance Stamp for healthier, safer tourism. That stamp is measurable and viable and verifiable in that you must have gone through a COVID-19 training, and you must be reporting on an electronic platform information in real time, so that if there's any problems, there's an alert. So only then you get the stamp. And anybody with the stamp is then given free publicity on our app. And the app is that one place stop where you can get information on travelers' health for any country that you're going. So for instance, I'm in St. Lucia right now. It tells you what are the vaccination requirements, where the health centers are, what are their prevention methods, and so on. So this is one way of promoting health and safety in the region. So we're enhancing visitor health through this staff. And I think this is my last slide, and I know my time may have been up, but I really wanted to talk.
But we'll let you sneak it in, Lisa, please.
Thank you, thank you. Yes, so we're really enhancing visitor and local health. And by doing so, we promoting that health and safety of our travelers. And the novelty of that program is that the digitalized systems of reporting, I mean, you can actually do it on your phone and it can be accessible with all the alerts. So I want to thank you for taking the time to listen to my presentation, and hope that I have set the stage.
Thank you so much. Well done, Lisa. I have some questions. I know others have questions, but we will wait until everyone has presented. I hand the baton to Frank to talk about telecoms, ICT, perhaps infrastructure, and your perspective on the same questions that I began with. Over to you, Frank.
Many thanks, Annalee, and good morning, everybody. Delighted to be here today to share, I suppose, some perspectives from a telecoms operator perspective. And I've been blessed to have lived and worked in the Caribbean region for the last 21 years. I'm very lucky to have traveled and visited every country for work mostly, but in some cases for pleasure, having lived in St. Lucia and Cayman and most recently here in Jamaica. So I suppose, you know, there's two ways I'd like to discuss this morning. I suppose if we look at today, what does a travel bubble mean to us today for a licensed telecoms operator across the region? And most importantly, in the area I'd like to focus on mostly, what could it mean from us working with all the various stakeholders? And, you know, what responsibilities do we have as corporate citizens and, you know, investors in this telecom space? I suppose when we started Digicel, and it's driven very much by the philosophy and the DNA really of our company, driven by our chairman's philosophy, we believe wholeheartedly that it's everybody's basic human right to have access to affordable and reliable communications, no matter where they are. And we've seen and we've made some very heavy investments to make sure that has occurred in the last couple of years. Examples being, you know, subsea cable into Montserrat to replace the one that was devastated with the volcano, but for the first time to bring subsea cables through the Grenadines as well. So we're a heavy investor. We've probably invested to date about $6 billion into the Caribbean region. And we will continue to invest heavily to make sure we bring the latest and greatest technologies. So I suppose, you know, looking towards the future, and probably the three areas we'll look at this morning, I want to bring an update in terms of what we're doing in the roaming space. So that no surprise, there are two large operators across the English-speaking Caribbean, Flow, Cable Wireless, and ourselves. And typically we've networks in all of the countries. In some cases, we have single state operators, be it in Antigua with APUA, be it in Guyana with GT&T, in Suriname, different examples. But primarily, you know, two large operators, and we work very well together, and we've made big investments in making sure that there's great networks across. And I want to speak in a few moments about an update in terms of some great developments in that space. The second, I suppose, is, you know, the ease of moving around. And it always amazes me when I'll talk to somebody, for example, in St. Vincent, and I will say, you know, have you been to St. Lucia? Have you been to Dominica? And it always is incredible for me where they say, no, I never have been, you know, but I've been to Miami, I've been to London, I've been to Toronto, I've been to New York, I've traveled the world, but I've never gone to my next door island or some of our neighboring islands. And, you know, nobody's ever said to me, the reason I don't travel from one island to the other is because of the cost of telecom services. It's primarily the cost of flights. It's not easy to travel because it is difficult to go from one country to another based on the schedules, apart from the price. And some of our markets are not cheap. You know, if you've got to stay in a hotel, if you're bringing your family, it is actually a lot cheaper to go to some of the other places like Miami and New York. And I think that's something, you know, we've all got to work as stakeholders to say, how do we make it easier for people to move within the region? And certainly technology, we have a huge role and responsibility in that area to work with governments. And particularly if we look at the areas, as Lisa just mentioned, obviously the global pandemic, we would love to see a system where everybody is registered. So if they have been vaccinated, and this will become a requirement, it's inevitable in every country that you will not be allowed to enter unless you can prove you've been fully vaccinated. You know, we've got to work with governments, absolutely adhering to people's privacy of their information, but that it becomes on a seamless basis. So if a cruise ship passenger comes into St. Kitts, that they just once register and forever when they come through the region, it's very simple and it's straightforward, and everybody knows, the governments, no, not everybody, the government will know their confidential information. Similarly with, you know, landing forms, we've all had the hassle of filling in the landing form, coming in on a IATA flight into Dominica or any other country. We've got to digitize all of these things. The investments have been made in the technologies. It's happening in other places around the world. We can't let the Caribbean slip behind. And again, you know, they're really important areas for us to develop. And we have a responsibility, as I said, as a telecommunications investor, to make sure that happens and to really create a proper travel bubble right across the region. A couple of things, as I said, I'd like to talk about some of the developments that are happening. And it's been spoken about a couple of times this week, and it's certainly been spoken about in recent years. But the CTU's ambition to have a single ICT space across the region, which, you know, we're a big proponent of as well. And we want to see some huge developments taking place very soon in that area. And one of the things when it comes to roaming, many people will say, you know, why can't we have a roaming platform like in the European Union? So, you know, I can go from Ireland, where I'm from, in the European Union with my Vodafone phone and roam seamlessly and very cheaply into France, into Germany, wherever else. So why can't we do something like that in the Caribbean region? And there's a number of obstacles. They're not insurmountable obstacles, but there are a number of things that we have to go through before we can put something like that in place. The European Union, it probably took about 20 years to harmonize most of the telecommunications legislation. And I know the CTU is working towards having one regional regulator, and obviously regulators within the markets for their unique specific requirements that are regulated. But, you know, that has to happen. We have different laws, we have different licenses for the telecoms operators, we have different responsibilities, rules and regulations. So we need a harmonized approach. And some of the examples in relation to that will be, we have an obligation under our licenses in certain countries to allow for lawful call intercept. So if the authorities want to check on somebody's records, they will come through the police. We have people in our business intelligence privacy divisions, and we will provide those records to the police with a proper court order. That is a requirement in some markets, it's not in others. So if we allow somebody to roam across markets using traditional voice services, we can record those and we can understand from their billing where they've been, etc. And I don't want to dwell too much in the whole space of over-the-top operators, the Facebooks of the world, etc. It's been dealt with by my chairman this week and on numerous other occasions. But, you know, the number of obligations that we have to adhere to as a licensed telecoms operator versus the way the world has moved, there's a massive disparity between those. So, as I said, firstly, there needs to be a harmonized regulatory approach within the Caribbean region, and we're working towards that. And Rodney Taylor has certainly made great strides since his recent appointment into the CTU, and we're delighted with that, working with Rodney and Selby, etc. The second one is a harmonized taxation. So some markets today, we have to pay a fee or a levy for inbound international calls that come into that country. And, you know, great initiative from governments who said, we're going to set these funds up, and the fees that we make from those, we're going to invest it into education projects. Excellent idea. But it means that it's more expensive to call into some countries than others. And as a result, if we were to introduce a roaming product, it will be at different prices for different countries. And then the third thing is the European Union has a common currency. Today in the Caribbean region, we've got to deal with the FX movements of the Jamaican dollar, of the Haiti gourd, the Guyanese dollar. So there's some massive swings in those currencies, as many people will be aware. But as I said at the start, none of these things are insurmountable. With the leadership of Prime Minister Motley and Prime Minister Mitchell from Grenada, we started this process about 4 months ago, and heavily driven by Rodney and Selby in the CTU and their team. But we now have Flow and Digicel at a table, and it's been well documented in the public domain, where we're all going to work together to introduce a roaming product that will be more transparent, that will be simple, and it will be predictable. So nobody wants to come home and get their mobile phone bill, as has happened to all of us, and to have what we call bill shock. It's a very common term that everyone has heard of. Because you've roamed across several markets, you've gone internationally, you come home and you go, wow, I didn't believe it was going to be that expensive. And, you know, we've a responsibility to make sure it becomes more affordable in this Caribbean CARICOM travel bubble. So we're both, or all parties are under an NDA, so I can't get into too much details on it, but I can absolutely say wholeheartedly we've made significant progress. We meet again next week when we're going to be discussing propositions that both sides have put together. And Selby has been a tough taskmaster, as he always is, and he has set from the outset about a couple of weeks ago that he wants to be in a position within 3 months that we have reached an agreement on what these products will be. That will be transformational for travel within the CARICOM region. There is no question about that. And the further projects that we are hopefully going to work with all stakeholders and with governments, as I mentioned, will be in the area of being able to track people in terms of their vaccination, in terms of their PCR tests, to make it easier for people to travel within the region. And there are massive issues in relation to data privacy in that aspect. And the final area where they're looking to, and we would encourage the governments to work with, will be in terms of digitizing the whole process for somebody when they leave, in terms of all these forms that have got to be filled in. I'm not sure anybody ever does anything with these forms afterwards, but you know, we need to make it easy. We've LTE networks, as indeed do Flow, right across the region. We've fiber going left, right, and center across the region. So the connectivity is there. The technology is there. The case studies from other countries are there. And we've got to move forward quickly in relation to that aspect.
Thank you so much, Frank. We appreciate it. I would like to just do a time check really quickly with Josanne. We have 2 more speakers. Filipe, you're up next. So please, 5 to 7 minutes, and then we hand over to Donovan immediately. Filipe, please.
Sure. Thank you, Annalee, and Your Excellencies, ministers, for the opportunity of being here. I want to build on what I heard here from our colleagues, Dr. Lisa and Frank. We also have a few challenges to work in the region to get the business to grow. So as Frank rightly noticed, it's still very expensive to fly in the Caribbean. And to some extent, this is due to the low volume of passengers. So part of the situations we've been discussing over the past with different entities in the Caribbean is how to create conditions for more people to fly in the Caribbean and the people that come from abroad to fly intra-islands, and something that we see as a great potential that is not yet fully utilized. So speaking yesterday when we were kind of doing a briefing here for the session, Annalee reminded us all of the Cricket World Cup in 2008, if I'm not mistaken. And this is where we would love to go back. This is, I think, a very good ambition to have, something that, again, we've been discussing with the authorities in the region, and we believe it's the time to do it. And so the time is a time of crisis for our sector. It's true that many of the islands in the Caribbean are recovering well from the pandemic and are regaining the traffic volumes that they used to have prior to the crisis, but there's still room to grow. And not all other jurisdictions will eventually, someone is asking here for a click, said not all other jurisdictions around the world will eventually open so rapidly as you guys have been opening up. So it is an opportunity for yourselves to capture market share and to grow your participation in the tourism sector. But so, as Frank was saying, we also need some legislation to be aligned. We have challenges with taxation as well. We've been discussing that with the authorities, and we hope that the crisis and, again, the opportunities that come out of the crisis, that we can take advantage of them and build something together for a better future. Lisa was explaining about the requirements for traveling and how it all comes together. And part of what we do here at IATA is to work together with different government authorities, which we again would like to thank for the help and cooperation over the last many months. We collect all the travel requirement information that governments issue, and we make sure that passengers receive that information. So we've always done that historically because of our needs to make sure that passengers comply with requirements across borders. And now we've been to a great extent also asked to help disseminate information about requirements for travel regarding the pandemics. And for that, there's only one way to go. It's to digitize, as Frank was saying. I think the very good news that you guys have, it's a major step forward that not many countries do have, is the work that you do together with the GRCC, and I'll let Donovan speak to that in a few minutes. But the fact is, you already have an entity in the GRCC that collects all information from passengers flying into the region, which we believe is a great potential for as a platform to build and to grow the business. And specifically back to the pandemics and the need to digitize, I think one element here is the fact that there are solutions out there already. So we started a solution ourselves to help the airlines manage the situation, which will also integrate with governments. So Annalee was speaking about the initiative on the Beam Safe. We've been working with the provider as well. There's opportunities in the region. We've been speaking to a few of you on how we can get the apps that have been developed, not only our app, but other apps around the world that have been developed to help deal with compiling information around the pandemic and sharing passenger data, meeting the PLF, the passenger location form, and other requirements that currently exist, how to get it across to the passenger and collect that information and make sure that information gets handed over to you in a timely fashion. And if this is come true, we can anticipate a profound transformation of the entire travel process. So imagine the following scenario. Imagine I'm here in Miami, where I live and work, and I go to an island, and I can go to an app. I can say, this is me, this is my passport, this is my biometrics, these are my biographics, this is my vaccination report, vaccination certification, whatever it might be. And I will push that information straight before I even get to the airport, before I even jump into a plane. I'll push that information straight into yourselves, into the governments. Imagine the quality of information you have, and imagine how much you can do in terms of vetting and facilitating the entire process. So potentially you could say, well, that passenger is not meeting the requirement. I'll not even allow him to board the plane to fly here because I don't want to have to deal with the problem when he gets here. I'd rather stop the passenger from coming. So that's something that can be done. It will also integrate into every other system. So GRCC is one, but we can imagine very well that the information gets integrated, for instance, into the health systems around the region, because passengers will be sharing and are willing to share their information regarding vaccination. Of course, as Frank said, GDPR needs to be fully considered, needs to be fully in place, no doubt about that. But there is a clear indication from travelers that they're willing to share that information beforehand. And if you were, and again, taking it back to the Cricket World Cup example, if you were to harmonize some of this legislation and allow people to probably travel more freely around the region, we are very convinced that adding up all those elements, it will definitely be a booster for the business going forward. So I think, Annalee, here to sum up, the opportunity is, we do have a crisis, and as the saying goes, never lose a good opportunity, never lose a good crisis. The opportunities that come out of it. Let's work together. The solutions are there. We don't need to reinvent the wheel. Everything is out there. It's a matter of us coming together and agreeing on a plan on how we want to take it forward. Thank you, Annalee.
Thank you so much, Filipe. Donovan, you're bringing up the rear end. I'm told that we are slightly over time, sir. So you need to accelerate your presentation, please. Thank you.
Hey, good morning, all. Thanks, Annalee. Right, so briefly, we know the brief synopsis already. The pandemic has brought about the following realizations, and that's basically the importance of a continuous border security, a need for a data repository to simplify regional movement, and the need for a private regional access network for faster information access, as would have been mentioned by Frank. So from the GRCC's perspective, our main objective is basically the simplification of regional travel amongst the CARICOM member states through the correct integration and employment of technical solutions. And this means safer measures of travel for all vaccinated persons and persons who have produced a negative PCR or rapid antigen test as per country. We also must maintain, though, the optimized effective national and border security. And this can only happen if there's a continued collaboration amongst the CARICOM member states, and more importantly, a cross-platform integration and collaboration. So how could this be achieved? Continue access to travel database and manifest through member states via the GRCC. I would propose here the adoption of the ICAO document 9303 or the implementation of an electronic passport across the region. This will lead to the cross-sector regulatory collaboration, as mentioned by Frank and Filipe earlier. Frank, you should like this one. The implementation of a private secure network to allow all member states to access a database, thus allowing the cross-platform communication. And we must ensure data integrity to ensure non-repudiation. So basically, this pictorial here gives you a good example of what the solution could look like. This is already in place today via our APIS management at GRCC. But to add to that, we can have the vaccination, electronic declaration form, and the PCR information that Dr. Indar would have mentioned. If there's a database there, we can also link that to our visa information, and it's collected through the API. We will then pass through the validation process, and once that's validated, we can actually go through process 2, 3, and 4. This is to make sure that we do not have any loopholes or any threats as it relates to human or people coming through our borders. Security and safety is a must, whether it's health or whether it's, well, criminal. But we must consider policies. We must consider policies. Pertinent legislation and regulations, implementation and amendment. So our government, our ministerial agencies must work together to form one common policy, and that's communication and collaboration. Agreements with other parties and agencies. So from the telecoms entity, the health sector, the business community, everybody, all the major stakeholders and shareholders must come together. We must have higher level policies. And then we must look from the security perspective, the anticipated threats. Then we must look at the implementation, operational, and maintenance costs. Nothing is free, but if we work together, then the cost can be absorbed. CARICOM's risk tolerance. That must be looked at as well, and as well within the policy. That must be considered. To conclude, I would say that in light of a viable tech solution for a regional travel bubble, the aspect of border security becomes even more critical. In the simplest of terms, the protection of our borders from the illegal movement of weapons, ammunition, drugs, contraband, and human trafficking, while promoting lawful entry and exit, are essential to national and or regional security, economic prosperity, and national sovereignty. Thus, CARICOM IMPACS and the GRCC included can continue to be that single window to facilitate all linkages among local, regional, and international law enforcement, which can be extended to the health sector, business sector, and most importantly, the telecommunications sector. Because if we don't have a stable platform, a stable network, we can't do anything. So we must make it more robust, in some cases, through legislation, and we must really look to enforce 100% compliance. We already have the ED card that's working. We must also look at a regional integrated program that, as Lisa said, to track the vaccinations via database for both visitors and citizens. Ladies and gentlemen, we really need to invest in the capacity of the institutions. We really need to. While we are still giving millions to private or corporations, the capacity then resides for us to make it work. And with that said, I would like to conclude and say thank you.
Thank you so much, Donovan. Excellent acceleration. I am told that because we did start late, so we technically should have 2 or 3 more minutes to have some question answers. Josanne, do you know if there are any specific questions? Not hearing you.
Hello, Annalee, can you hear me?
Yeah, I hear you now. Go on.
Right. Okay. So do we have any questions from the team behind monitoring the chat? It doesn't seem as if we have any questions, Annalee.
So if we don't, I would like to suggest one of the things that I did want to ask the panelists, each of you in some way stressed digitization and that we have to speed up digitization. Everybody knows that, and it's not happening. Do you have one solution, one thing that you think can be done from a regional perspective, a national government perspective, to get that digitization actually accelerated? And I'd like to go from my right to left, start with Lisa and go over. Lisa?
Yes, thanks. It has to be the agreement of harmonization for the digitization, because what are we digitizing? The second speaker was speaking about there were different requirements. CARPHA would have recommended a set of minimum requirements as harmonization. So the first thing, we must have that, I want to say, high level agreement among the heads that say, these are the things that are needed. We need the testing, we need the vaccination data, and what are the other data that we need? And what are the general requirements for travel? And so there must be that commitment to allow for that. And then I think the rest could be quite easy in that, we have CARPHA, for instance, has a lot of different access to different databases. The coordination of all of this, you have IMPACS and you have other bodies. The coordination of that and that information is important. So for instance, our sister agency, IMPACS, would have different types of information. We would have on the health, but they would have security-based type information, if a traveler may be coming from a risky population. So sharing the integration, having I don't know if it's possible to have a one platform, but a platform that can be shared that allows us, to have access.
That's excellent. Yeah. Thank you. Yeah. So I got what information, so some decisions on what we want to start to collate, and then coordination. Frank, yes. You have 30 seconds.
Hi, thanks, Annalee. Yeah, I think I totally agree with what Lisa's saying. Fabulous idea. So if we agree, what's going to be done, well, perhaps we take a country in the Caribbean region and, we bring all the stakeholders
yes.
in. And we use that as a pilot. And, I'm very fond of Montserrat. Made great strides. Subsea cable now. We've just deployed a new nationwide fiber network. Montserrat will probably become the first Caribbean nation to be everybody with access to fiber. So we take something that's bite-sized, we can manage and run it as a pilot and get it up and running.
I love that idea. I am a great fan of Montserrat and a lover of Montserrat. One of my biggest projects and first projects was in Montserrat. So I certainly would be on stream. Beautiful people, beautiful country. Filipe, 20 seconds.
20 seconds. So yeah, building on what Lisa and Frank were saying, yeah, pick one place, and I think then it's only one thing: it's a political will to do it. There's need to be the political mandate to do it, and it will get done. So it's not rocket science.
So political mandate. Thank you so much, Donovan. As always, last word to you, sir. Or second last word, please.
Communication, collaboration, proof of concept, implementation. So even faster, you plan, you develop, you implement, you operate, and then you optimize. But most importantly, you communicate.
Yeah. Excellent. Thank you so much. I would like to thank Josanne and the CTU for this wonderful session. My mandate was, and our mandate as a panel, was to give some guidance that the CTU wanted to perhaps have some workshops to follow up on this and to bring a much more fulsome but coordinated approach to how we deal with issues related to the travel bubble. I think we've achieved that. Please stay tuned, because I think the CTU is going to come back with some other steps that we can follow. Thank you all so much. It was fun.